If you take a blood pressure pill, pick up the bottle now. Never stop, skip, split, double, or shift a dose on your own. But during a heat alert, 5 ordinary mistakes can raise your risk of dizziness, dehydration, falls, or an emergency. I'm Dr. Daniel Mercer. This is general education based on guidance from the CDC, the National Institute on Aging, and the American Heart Association. It does not diagnose you, replace your clinician, or tell you to change a prescription. Follow the personal plan from your prescriber. Let's start the countdown. If heat feels harder on you now than it did years ago, you are not imagining it. Age, chronic conditions, medicines, and heat exposure can stack together, and that combination is exactly what this countdown is about. A heat alert is not just another line in the forecast. If you are over 60 and take blood pressure medicine, it is a signal to review the plan for your day. Imagine a typical situation. The morning feels pleasant, so someone plans to mow the lawn, walk to the store, and attend an outdoor event. By afternoon, the heat has intensified. The medicine has not suddenly become dangerous, but the conditions around that person have changed. The mistake is waiting until symptoms begin before thinking about the schedule. The safer action is simple. When an official heat alert appears, pause before the day starts. Move non-essential outdoor activity away from the hottest part of the day when possible. Identify a cooler place you can use. Keep your phone, medication list, and emergency contact available. Then follow the medication and fluid plan your healthcare team has given you. If no one has given you a heat day plan, do not invent one by changing the pill. Make that the question you ask. When there is a heat alert, what should change in my activity, monitoring, and fluid plan, and what should stay exactly the same? The advice, just drink more water, sounds harmless. For some viewers, it may be incomplete. For others, it can conflict with a medical fluid restriction. Some blood pressure medicines can reduce the sensation of thirst. That means thirst may not be an early enough signal for everyone. But there is also no single amount of water that is safe for every person watching this video. If you have heart failure, kidney disease, or have been told to limit liquids, more water is not automatically safer. The CDC and the National Institute on Aging advise asking what your fluid plan should be during very hot weather. Imagine a typical case. One person waits for strong thirst, even though a medicine may blunt that signal. Another hears a large daily water target online and follows it despite a fluid restriction. Two opposite choices can come from the same generic advice. Your safe action is not a number from this video. Ask, on a very hot day, what does appropriate hydration look like for me, given my heart, kidneys, medicines, and any fluid restriction? Write the answer down where you keep your pills. And do not add salt, electrolyte powders, or sports drinks simply because the day is hot. Those choices also belong inside your individual plan. Your usual walk, gardening session, or errand can feel completely different during a heat wave. The mistake is assuming that because the activity was safe last week, it must be safe at the same pace and time today. Older adults may release heat less efficiently. Some medicines can blunt thirst, lower blood pressure further in the heat, or interfere with sweating or heat dissipation. The result can be dizziness, weakness, or fainting, especially when several risk factors overlap. Imagine a typical afternoon. Someone takes the same route to the store they always take. Halfway home, they feel weak and unsteady. They try to push through because the walk is normally easy. The important change is not the route. It is the heat surrounding the same body and the same medication plan. The safe action is to reduce avoidable exposure before symptoms force the decision. Shift non-urgent tasks to a cooler time if possible, use a cooled indoor option, and ask for help with an errand rather than proving you can finish it. Follow your personal fluid plan, not a universal target. If exertion repeatedly brings dizziness, weakness, near fainting, or unusual shortness of breath, stop treating that pattern as a test of willpower. Record when it happened and contact your healthcare team for individualized advice. Before number 2, Check the drugstore aisle. Adding an over-the-counter pain reliever such as ibuprofen or naproxen on top of a water pill and an ACE inhibitor or ARB, especially when heat has left you dehydrated, is a well-documented combination linked to sudden kidney injury. Researchers often call it the triple whammy. Over-the-counter does not mean irrelevant. Imagine someone with knee pain taking ibuprofen during a heat wave without mentioning it because it was not prescribed. Their clinician or pharmacist cannot assess a product they do not know about. Do not replace it with another pain reliever based on this video. Ask a pharmacist before using an NSAID during a heat wave, and make sure they know about your water pill, ACE inhibitor, ARB, kidney history, heart history, and fluid plan. Quick check-in before we finish the countdown. Tell me in the comments which state you're watching from, and whether your area is under a heat alert today. Please do not post your dose, blood pressure readings, or other private medical information. Your general location and the word alert or no alert are enough. Number 2 is saying, "I'm just getting older," when your body is asking you to pay attention. Heat exhaustion can involve thirst, dizziness, weakness, heavy sweating, nausea, clammy skin, or a faster pulse. These symptoms can overlap with low blood pressure, fluid loss, and medication effects. They do not diagnose the cause at home, but they are not signals to ignore. For someone taking both an ACE inhibitor or ARB and a water pill, hot weather can meaningfully raise the chance of dehydration, low blood pressure, kidney strain, and falls. Again, this may raise risk. It does not guarantee an event. Imagine a typical case. Someone stands after sitting outside, and the room seems to tilt. They feel weak, notice nausea, and need the wall for balance. Because they have felt a little slower for years, they decide this is normal aging. The missed clue is the new pattern during intense heat. Move to a cooler place, rest, and follow the heat day fluid instructions your healthcare team has given you. If symptoms do not improve, contact your clinician. If you faint, become confused, develop chest pain, or have another red flag symptom, use the emergency plan we will cover in a moment. Your prescriber sets your personal blood pressure targets and warning thresholds. Know those numbers and that plan. No single blood pressure number in an online video can safely replace instructions made for you. The number 1 mistake is also the most understandable. Feeling dizzy or seeing a reading you do not like, then deciding to skip, split, double, stop, or move a dose without a plan. That is the rule you heard at the very start of this video. And here is why breaking it under pressure is riskier than it feels. Look at the label on your bottle. A diuretic, often called a water pill, can affect fluid and electrolyte balance and may contribute to dehydration, reduced thirst, falls, or fainting. ACE inhibitors and ARBs can blunt thirst and lower blood pressure. Beta blockers can interfere with the body's ability to release heat and can contribute to heat-related fainting. Calcium channel blockers can affect electrolytes and blood pressure, which may increase fall risk. Those are different mechanisms, not a contest. The clearest combination warning in the CDC guidance is for an ACE inhibitor or ARB taken with a water pill. In hot weather, that combination can meaningfully raise the chance of dehydration, low blood pressure, kidney strain, and falls. It is a population-level risk, not a prediction of what will happen to you. A normal reading may mean your treatment is doing its job. A dizzy spell may need attention, but it does not tell you which pill to change or whether a dose should be changed at all. The correct response is a plan, not a home experiment. It can sound logical. The heat may lower my pressure, so I will skip today. Or, my reading is high, so I will take extra. But a single symptom or reading cannot tell you which medicine is responsible, whether the measurement was accurate, or what another dose will do alongside the rest of your medications. Imagine a typical case. Someone feels lightheaded after an afternoon outside and skips the next morning's pill. Later, a reading is higher than expected, so they take an extra dose. The person is trying to be careful, but they have created a dosing experiment without knowing the cause of the original symptom. The CDC reminds patients not to stop medicines abruptly without a plan. The American Heart Association says to take medicines as prescribed unless a healthcare professional tells you otherwise. So repeat this sentence with me. Heat changes my plan only when my prescriber or pharmacist tells me how. Ask in advance. If I feel dizzy, become sick, cannot keep fluids down, or get a reading outside my personal range during a heat wave, who do I call? What do I monitor? And what should I do with my next dose? Get the answer before the emergency. Keep it beside the bottle. Never stop, skip, split, double, or shift a dose on your own. Heat exhaustion and heat stroke are not the same. Heat exhaustion may involve thirst, dizziness, weakness, heavy sweating, nausea, clammy skin, or a faster pulse. Move to a cooler place. Rest, follow your personal fluid instructions, and seek medical guidance if you are not improving. Heat stroke is a medical emergency. Warning signs include confusion, fainting or loss of consciousness, and a very high body temperature. The skin may be hot and dry, but a person can still be sweating. The pulse may be strong and fast, or weak and slow. Call 911 immediately for suspected heat stroke. While help is coming, move the person to a cooler place if it is safe. Use cool compresses and use a fan. Do not wait for a blood pressure number to make the decision. Also follow your emergency plan for fainting, confusion, chest pain, or other red flag symptoms your clinician has discussed with you. Your personal pressure thresholds come from your prescriber. This video will not invent a universal number. And even in an emergency, do not make a future dosing change on your own. Once immediate help is underway, the treating professionals can review the medicine, heat exposure, symptoms, and fluid status together. Here is the plan to save. Place every prescription, over-the-counter medicine, and supplement on one list. Include products you take only sometimes, especially ibuprofen or naproxen. Photograph the labels if that is easier. Write down any fluid restriction and the names of the clinicians or pharmacists who manage your medicines. Do not sort your pills into safe and dangerous based on this video. The purpose is to make the whole combination visible. Ask your prescriber or pharmacist 3 questions. First, do any of my medicines affect thirst, fluid balance, blood pressure, sweating, or heat release? Second, what is my personal hydration plan during very hot weather, especially if I have heart failure, kidney disease, or a fluid restriction? Third, which symptoms, blood pressure readings, or changes in urination should trigger a call? And what should I do about the next scheduled dose while I wait for instructions? Write down the answer. A heat day plan is only useful if you can find it when you feel unwell. Check that your home monitor, medication list, emergency contacts, and clinician instructions are together. Learn your personal target and warning range from your prescriber. If you track readings, also record the time, symptoms, heat exposure, and medication timing so your healthcare team can see a pattern. Review the plan with a family member or neighbor who might notice confusion before you do. And identify the cooler place you can use if your home becomes too hot. There is a printable heat day medication checker linked below this video. It does not calculate a dose or diagnose a symptom. It helps you organize the questions, medicines, and warning signs to review with a professional. Myth 1. It is extremely hot, so skipping one pill is safer. No, heat can change risk, but it does not authorize a dosing change. Never stop, skip, split, double, or shift a dose on your own. Agree on the plan in advance. Myth 2. Everyone should drink the same large amount of water during a heat wave. No, some medicines can blunt thirst, but heart failure, kidney disease, and fluid restrictions make universal advice unsafe. Your healthcare team should set your heat day hydration plan. Myth 3. If I am not thirsty, the heat is not affecting me. Not necessarily. Some blood pressure medicines can reduce thirst, and heat illness can show up as dizziness, weakness, nausea, heavy sweating, fainting, or confusion. Watch the whole pattern, not one signal. The best response is not panic. It is preparation. You do not need to fear every hot day or every pill bottle. You need a plan that connects the weather, your medicines, your heart and kidney history, your fluid instructions, and your personal warning signs. That plan turns vague anxiety into clear questions. It helps your family know when to call. And it lets your prescriber or pharmacist make decisions with the full picture instead of one isolated reading. Getting older does not mean dizziness, weakness, or confusion should be dismissed. And taking blood pressure medicine does not mean you are powerless in the heat. Preparation is the safer form of control. If this guide helped you, subscribe to Dr. Daniel Mercer for calm, evidence-based health guidance after 60. Download the Heat Day medication checker below, complete it without changing any dose, and take it to your pharmacist or prescriber. In the comments, write plan if you are going to ask for your personal Heat Day instructions before the next alert. Share this video with one person who takes a blood pressure pill and still treats a heat warning like ordinary weather. And watch our next guide on amlodipine, losartan, and lisinopril. It explains the ankle swelling, dry cough, dizziness, potassium questions, and drugstore interactions many people are never taught to recognize. Keep your plan beside your bottle. Stay alert to the heat, and never change the dose on your own.